December 2023, Rajshahi Medical College Hospital. Dr. Tahmina Akhtar had 12 high-risk pregnant women, all needing progesterone suppositories to prevent premature birth. The supplier said global cocoa butter shortage. The pharmaceutical company can't manufacture. Maybe February? Dr. Tahmina called every pharmacy in Rajshahi, Dhaka, Chittagong. Sold out everywhere. One pharmacy in Gulshan had 3 boxes at 4 times the normal price. She bought all 3 with her own salary. 3 patients covered. The other 9 went without. 2 delivered prematurely. 1 baby did not survive. Then she asked a question I couldn't answer. Why are we importing ingredients that we could make ourselves? Today, we answer her. Bangladesh hemorrhages $1.3 billion every year importing pharmaceutical raw materials. 80% of our production depends on foreign supply chains. When those chains break, our patients suffer. Meanwhile, we discard 875,000 tons of mango seed kernels annually, kernels containing the exact same pharmaceutical compounds we import from another continent. We poison our rivers with waste while buying back what we throw away. That is not inefficiency. That is a crisis hiding in plain sight. Dr. Monsur Mokbul's 2023 peer-reviewed study confirms it. Mango kernel fat is bioequivalent to cocoa butter. Identical fatty acid profiles, 26% palmity, 36% stearic, 34% oleic. USP pharmacopoeia compliant, high stocks content, verified. Published science, not a hypothesis. Imported cocoa butter cost $4,000 per ton. Our verified production cost $2,000 per ton. We sell at $4,000 per ton at 45% gross margin. But here is what truly breaks the playbook. We get paid to collect the raw material. Processors like PRAN, BD Foods and Aki's currently pay to dispose of mango seed waste. We offer free pickup. Their disposal problem disappears. We acquire thousands of tons per season at negative cost. Pure B2B sales to pharmaceutical and cosmetic manufacturers. First mover in a completely uncontested domestic market. Log supply from top processors, negative cost, raw materials, no competitor can replicate. USP compliant regulatory pathway already mapped. This moat is structural, not temporary. We earn our way up. Year 1, small clients. Fast cycles, low risk, we build case studies. Year 2, mid-tier, Kia Cosmetics, Aristopharma, armed with validated batch data. Year 3 to 5, big pharma, Square Beximco, Incepta. Technical sales representatives, pharma trade shows, direct outreach to 100 manufacturing facilities. PDT 6.86 billion taka spends executing proven B2B methodology. Supply agreement with processors in active negotiations. Production costs verified through direct supply reports. University validated science underpins every product claim. Total startup investment is $25,000. The infrastructure is real and ready. 5 UN SDGs, 1 business. Good health, decent work, industry innovation, responsible production, life on land. 200 plus jobs by year 5. 1.84 million tons carbon dioxide eliminated annually. Pharmaceutical fat cost reduces 45%. 10 million patients get their medications on time. Budget, 35% equipment, 30% operations, 20% buffer, 10% certifications, 50% product development. Every dollar has a job. Dr. Tahmina bought 3 boxes with her own salary. 9 mothers went without. She asked why. We built the answer. By 2030, every suppository manufactured in Bangladesh begins its journey in a mango orchard. Farmers earn income from waste they once paid to dump. Pharmaceutical companies source locally at 45% lower cost, and no doctor ever again has to choose which mothers receive medicine because a supply chain broke 8,000 kilometers away. The science is proven, the costs are verified, the market is waiting. Dr. Tahmina's question deserves an answer. We are the answer.